question.
Thank you. Dean Russell.
Thank you, Chair. I wanted to explore the previous topics a little bit further, if that's okay, around education, and also very lightly touch on mental health. Just to start off with, I'm very conscious that during the pandemic, at the start when we were doing Clap for the NHS, that quite quickly merged quite rightly into Clap for Carers. And I was just interested to get your view, perhaps, Una, if I may, in the first instance. Do you think the perceptions through the pandemic has changed attitudes towards wanting to work in social care?
Yes, I think it has. I think we did see an increased awareness of social care, particularly around the Clap for Carers, and I think we have seen new people coming into social care, as Anita said, moving out of other sectors, and I think the key question now is how do we keep people with the right values who are moving into social care. I think that people have seen that social care is so important to our communities and to families, and that probably wasn't visible before. I think we have more to do to remind people that social care is about more than care homes and more than older people, and to remind people about social care's role with working age adults, for example. And I also think there's an opportunity for us to flip the narrative around social care. It's worth, it adds about 41 billion to the UK economy every year, and a lot of that will go to local economies. And so thinking about the role of social care in terms of its potential with when we're coming out of COVID in terms of recovery, I think is going to be really key, and people being able to see themselves as part of that will be a really important part of the future narrative, I think.
Thank you. And if I may ask you, Rob, I was also interested in the lead up to people getting their careers specifically in social care, but also in health more broadly. In particular, how much emphasis should be put on schools and on early years education to encourage people to want to go into a career in this space? And is there enough being done right now in that area?
So I think you can always do more. So you may know that HE hosted the NHS Career Service for many years and works diligently with schools and others to promote what are, let's be clear, fantastic careers. I'm now 34 years in the NHS and would strongly say, these are some, and in social care, these are some of the best careers in service you can do. Look, I think, there's some evidence that that's working, and it's not just on the back of the pandemic and the service that's been demonstrated, but the number of applications to nurse training and if that is true more widely of an interest in kind of public service and care service, then I think we need to be able to capitalise on it. And again, I think there is something about, both the NHS, social care and universities and colleges acting as anchor institutions in their economies and working collectively to promote, these roles, because they're great careers, with good economic benefits for both the practitioner and the community. So I'm a big fan of promoting health and care careers.
Thank you. And just related to that, so last year I was involved in writing a report called Connecting Communities, where we recommended the concept of NHS cadets. So you've got police cadets, you've got army cadets, why not NHS cadets? And I've been very fortunate over the past year to literally coming up to a year volunteer at my local Watford General Hospital. And I've seen the inspirational figures of all the volunteers there, but especially young people who want to get careers in healthcare. And I just wondered whether, has the red tape been cut a little bit over the past year to encourage more volunteering in the NHS and social care in a way that perhaps wasn't there pre-pandemic? If I could go to you first, Rob, on that, I think Anita looked like she might want to come in.
Yeah, I'd have to say I'm not. Look, I think it's exactly the right thing to do. I'm not clear where people are progressing on our ability to do that. I think as Prerna and a team have said, look, let's focus on the NHS being an excellent employer. That has wider resonance about how do you engage with your community, how do you encourage this kind of a piece. It's very hard when people think they're just doing the incessant workload in front of them to think, how do we plan for the future? How do we encourage for the future? Because you have to put some effort into it and some resource. So our HR capacity has been held or reduced over many years. So the kind of people that can do the reaching out to schools and local groups to have the effect that you're discussing needs some support, I think.
Yeah, absolutely. And Anita?
Yeah, I wanted to emphasise that I think in particular, thinking about young people and the impact that the pandemic has had on their education as well, and people who have lost work in sectors which are going to be declining. We need to think a lot about not just the entry into undergraduate education routes, but making the apprenticeship system work really well for social care and for the NHS. And I know prior to the pandemic, we were struggling with numbers on apprenticeships for social care. So I do think making sure the apprenticeship scheme works really well is going to be very important for our ability to reach into different communities and attract people in. And then the things that people are talking about, what is known in the jargon as a skills escalator. So if you start in one job, which might be relatively low qualification requirement, you can get the on-the-job training and the opportunity to progress, so you can move from that job, acquire your qualifications and move into the next job up through the system. And all the evidence is we've got a lot of parts of the country, we were talking about London, but it's not the only part of the country, with vacancies. All the evidence is if you train local, people are more likely to stay. So in parts of the country where we're struggling, really thinking, how do we reach deep into our communities and find ways for the NHS and social care to be an option for them? That's a win-win, yeah? That's a benefit to the community, a benefit to them, and almost certainly a benefit to the NHS and social care system in terms of retention. That's why it can't just be a national policy. There's got to be that really good connection locally as well.
And can I just ask on that, you mentioned about skills escalations and so on and career progression. Do you find at the moment it's very vertical? I'm yet to see anything that really highlights that you could start a job in social care and transition in your career over to the NHS. It feels like there's two silos, and we talk about, even if you talk about the health and social care, it's not one thing, it's always separate. Am I correct in that assumption, and if I am,
a proportion of people do move across, but I'll get Una and Rob to talk about. I think there's still quite a lot that could be done to have qualifications and skills, particularly skills actually, that were achieved in one sector, passported as effectively as they could and recognised in the other sector. We've got to make sure that we do that in a way that doesn't just mean that people feel the only option to them if they join social care for progression is then to leave. And we really do need to make sure that it works both ways. And I think there is more to be done for recognition of skills development between the two sectors.
And can I ask you, Una, on that, and then I've just got one small question to ask after that, and then I'm done.
So I would agree with Anita. I think there definitely are people who move between social care and health. Unfortunately, it's most often from social care to health rather than the other way around. And I would also say that not health is only one system that social care interacts with. So a lot of people who draw on social care won't come into contact with the health system any more than I will, for example. And so I think it's not the skills and the knowledge and the career pathways might not always be attractive to people in social care. They might want to go into a different sector. But I think there is more that we can do to align and acknowledge and understand the career pathways between social care and health, but also thinking about the interdependencies. And so when we have a drive in the NHS for more roles, thinking about the impact of that on social care, and equally having as many people who work in the health system who deeply understand social care as possible is a real benefit. But planning in silos means that sometimes we're not thinking about the full impacts.
And very, very finally, just briefly, if I may, to you, Rob, I absolutely applaud the work that Claire Murdoch has done, Nadine Dorris, around NHS and social care, mental health. I was just keen to get your thoughts on, have there been any predictions or surveys done to look around the burnout of that, but also planning ahead to make sure we're capturing any concerns now? So, for example, PTSD doesn't become the disorder unless it's not treated. Are we looking at those sorts of things right now to make sure it doesn't become an issue in 2-3 years' time?
So I know we are. I think you'll want to take that up with Prerna in your next session. Who will have kind of, that's part of the current planning we're doing is about the recovery staff and recovery of services, and absolutely those kind of issues around people's experience, which isn't universal, it's individual, and how we manage that and care for our people appropriately is going to be a key part of that.
Thank you.
Okay, thank you.
Thank you. Let's move on to Dean Russell.
Thank you, Chair, and thank you, Minister, and thanks as well to all of the staff that have been doing incredible work over the past year and longer. My questions relate to mental health, a little bit on volunteering, a bit on digital, if I may, so broad but connected. In the first instance, on the mental health side of things, I was really keen to understand what measures are in place at the moment in terms of measuring morale for staff, and how is that translated into the take-up of people taking on board the mental health support that's been offered over the past year?
Thank you, Dean. And it may be, if you're happy to bring in Prerna to give more detail on that, but I would say, first of all, it's something that I take a great interest in and feel very strongly that we should be regularly hearing, quite formally, I guess, from the frontline workforce on morale, along with having informal conversations and qualitative input. And I make sure that I am all the time speaking to frontline, both NHS workers and those in social care. In a more structured way, there is the annual NHS staff survey for the NHS side, which we'll be reporting soon. And there's also a pulse survey, which a sample of NHS staff are providing regular input into. Though also in terms, so measuring morale and what people are concerned about is really important, but at least as important, in fact, arguably more important, is making sure that we act on it. And so that is something I'm really determined we do at both a national level and draw on what we learn, for instance, from the staff survey and these other sources, but also local teams and local employers need to be taking a regular rain check on how their staff are and acting on it too.
Absolutely. Could I bring in Prerna there as well, if you've got any figures or data that you could share, please?
Indeed. Thank you. Thank you for this question. And as I mentioned earlier, staff health and well-being was our absolute #1 priority since March of last year, as soon as, specifically related to the pandemic. And we stood up a national health and well-being offer with our advisory group, sharing with us the end-to-end pathway that they that they recommended. They also asked us not to over-medicalize the support that we were offering, as well as change a bit of the help-seeking behavior, because research shows that health and care professionals are the last to seek help for themselves. So that's something we really focused on in terms of communication. It's okay not to be okay. We asked leaders to role model accessing of this support. So I'm just reading some figures here so that I'm absolutely accurate. In March, we set up the offer for health and well-being apps. And the way that the apps are set up is that the feedback is inbuilt. So you know how when we go on to WhatsApp and they say, how was this call or whatever, the apps ask that as well. So we were getting a constant stream of feedback about how they were helping and what else people needed. So we added apps as we went along. In April, we launched a website that has been accessed more than 400,000 times since then. In April, we added a bereavement support helpline. We added a helpline with the Samaritans, which is 12 hours a day. We added a text support helpline that's 24 hours a day, all free, also accessible to care, so health and care staff. We then added a coaching offer for primary care staff. We added a suicide prevention app. And then in May, we added virtual common rooms. And why I'm saying we added every month is because it was actually through the feedback from listening to staff who were taking up this offer. So we got themes from the Samaritans helpline about what was on people's minds. Virtual common rooms, so people could leave a stressful situation and come in and talk about what was on their mind. Online Yoga Association of Christian Counselors support, because faith is such an important part of, well, so many of our lives, and places of worship were not accessible. So we set up online support for our staff. We set up support for working parents and carers, because the number of carers is already high in the NHS, and it went up exponentially with the lockdown. So we set up support for that. In July then, we had commenced the People Pulse that the Minister just mentioned, where 114 organizations across the NHS do a monthly pulse. I mean, not every organization does it every month, but we get a data set every month. Here, the headline figures that I want to highlight are two. One about feeling supported and feeling anxious, and the second, the difference for BAME staff and the experience that they were having. So feeling supported had a high of 68% and during the first few months that we were tracking it, and it started dipping from November onwards and is now at 62%. It is still at 62%. Feeling anxious was at a low of 29% in the summer and autumn and is now at 40%. So we've seen feeling supported come down a little bit and feeling anxious go up. And we use that feedback to then augment our offer and our communication. And all of this is, of course, complementing local offers of support. So there have been the mental health hubs. So taking this data, we launched the mental health hubs in November, and they've been coming on stream. We have got a bereavement support service for Tagalog speakers for our Filipino colleagues, and an app which is curated by BAME communities. So the other statistic and other data point that I wanted to share from the People Pulse is that there's been a difference in the experience of BAME communities. So there's been usually about a percentage point difference in how people are feeling anxious or supported. I mean, on the negative side from BAME staff. So I also listen and talk with BAME staff network leads every 6 weeks since the pandemic began. And some of the additions to our helpline and our health and wellbeing offers have been informed by them, as well as the 1 million risk assessments that the NHS undertook between May and September of this year and continues to keep current. That risk assessment idea came from BAME staff networks who I was hearing from. And then, of course, mitigating actions taken for BAME staff. Sorry.
Thank you. Sorry. It'd be great if you could submit that data and the up-to-date data as you get it as well on those statistics for us, please. I'm conscious of time, so I'd love to hear more of the details. But just a few other points from me, if I may. Just with regards the workforce, we often talk about the workforce, and often I think people think of that being the doctors and the nurses and the social care workers, but of course it goes much broader than that. And if I may ask you, Minister, when we look at, obviously the supporters and the cleaners and the support for them, but also more broadly, I've been mentioned to an early witness, I've been very fortunate to volunteer for the past year at my local hospital, and I've seen the real power of volunteers. And I just wonder how much, when we're planning for the workforce moving forward, how much we've included volunteers in the numbers and in the support that they can provide.
Well, you're absolutely right that we should think really, really broadly about the workforce. Actually, one of the positive things I've heard from talking to frontline teams during the pandemic is how some of the silos in the workforce have been broken down, and how people really are working together, and who you are and what your job title is has become much less of a thing in an organization where it's traditionally pretty hierarchical. And I think that's something that we should be able to draw on and make more of as we come out of the pandemic. But you're absolutely right, volunteers do fantastic stuff in the NHS, and we've also seen a surge of interest in volunteering to support the NHS. Thousands of people coming forward to help with the vaccination programme. We also saw thousands of returners, people who have worked in the NHS, coming back to support the workforce during the pandemic as well. So we need to look at all of these things as we go forwards. And one thing is looking at how we can continue to involve those returners, so that, for instance, those with clinical skills going forwards, as well as you say, the important thing that volunteers do. And I would say on the social care side, something I'm always thinking about is unpaid carers, who, while the employed care workforce say that they feel that they're an afterthought compared to the NHS, I hear that even more from unpaid carers who are doing such an important job, so to speak, caring for those they care. So I think we need to think about everybody involved in care when we look at our future system.
And if I may, just very briefly, because I'm conscious of time for other witnesses, other interviewees, but one of the things that I'm really conscious of is the technology that's over the past 5 years. We heard from Prerna about the importance of technology with regards apps and tools for mental health. How much does the workforce planning tie into the use of technology to free people up? I've done some work in a maternity office and the elastic bands are thicker than I've ever seen because everything's in folders and files and takes so much time for people to actually do paper filing rather than what they could do in no time online. Is that being factored into that planning over the next 10, 20 years as well?
So I'll say yes and say a few things, and then Prerna may be able to say some more on this, but no, broadly, absolutely yes. And we know that where you get technology right, you can save people's time and give your healthcare professionals more time to spend doing the thing that they're trained to do, which is providing patient care and doing less of the form filling. You can also make patient care safer if some things are automated and using technology. You have less of risk of entering data wrong and things like that. So there are just huge opportunities of technology. We've also seen many things of healthcare that have usually been done in person being done virtually as well, and that has it's not the answer for everything, but there are opportunities there as well. And we've seen a greater use of technology on the social care side as well. For instance, care homes being able to do remote consultations with a GP using a device, and that there's not necessarily need for the GP to come in person to the care home. So I think there are definitely opportunities, and we need to look as we build a recovery plan as to how we make the most of those opportunities, and that in turn is making the most of the workforce too. Prerna, do you want to add to?
I'll hand back to the chair actually, because I'm conscious of everyone's time. So thank you so much, both of you.